Alright, so we'll quickly try to look at another criteria, and when you are talking about the criteria, you are basically trying to say a disease condition exists, okay, but what is like the valid reason for me to actually say this disease condition actually exists? Do you understand? So for acute kidney injury, there's a way we approach it, okay. So there's a criteria we use for it so that I can know the stage. Knowing the stage will help you to know at what critical level the patient is. It will help you to now know the treatment options that you can be able to employ to tackle the disease condition. So this is an Acute Dialysis Qualitative Initiative. Like, that's the name of the organization that brought this criteria known as the rifle criteria. Of course, from seeing the rifle, from me, I can actually suspect that it's like a mnemonic, right? So looking at the rifle criteria, let's introduce it before we actually start looking at the different stages. Now, the rifle criteria we said that is developed by the Acute Dialysis Qualitative Initiative, and that was back in 2004 when I was very busy doing my primary school. I didn't know that people were already reading and doing stuff like this. So it was actually the first standardized system to define and classify acute kidney injury. That was early into the century when things were now rapidly coming up. So it provides a framework for assessing the severity and outcomes of acute kidney injury. And this is based on the various changes in serum creatinine, glomerular filtration rate, urine output. So you are looking at how the kidneys are able to put out this waste product of concern. That's what creatinine. Then you're also trying to look at how much of urine is being how much of blood is being filtered to produce urine, at what rate. They're also trying to look at how much of this urine is the kidney being able to produce. So on these three criteria, you basically you can measure, or ascertain the level at which you cannot measure the level at which the kidneys, the kidney damage has basically gone on. So looking at the rifle that I spoke about, you could actually look at this. So it's a mnemonic. So you are looking at the R, which is risk. You are looking at the I, which is injury. You are looking at the F, which is failure. You are looking at the L, which is loss. You are looking at the E, which is end stage renal disease. So for the risks now, if there's early kidney injury, talking about this based on serum creatinine and glomerular filtration rates and based on urine outputs. So if I just call any version or any type of the kidney injury, please you pause this video and look at the serum creatinine and urine outputs, because it's not something to just call out. It's something for you to calm down, look at how the values are changing, try to write it down and understand it for yourself. So early kidney injury, we have the parameters there. Moderate injury, we have the parameters there. Severe injury, we have the parameters there. Then acute kidney injury, which is persistent. Yes, it came but it's not going. Then end stage renal disease. That one, there's complete loss of kidney function for more than 3 months. Alright, so you can look at this thing here, and this image kind of like illustrates it very, very much more better. So you are just looking at how the kidney stuff is basically declining. So from risk, injury, failure, loss, and end stage kidney disease, or you can say end stage renal disease. So key features, draw criteria, is mostly based on creatinine and glomerular filtration rates. Do you understand? Then if you want, you can add up a urine outputs criteria. Progressive severity, so it's actually moving from better to worst. Okay, then outcome stages is loss and end stage renal disease. They reflect duration and chronicity. Do you understand? They show when it actually changes from being acute to being a chronic kidney disease. Okay, so limitations, it actually requires you to know the baseline creatinine, all right, which may not be available. Urine output can be influenced by a lot of factors. Okay, so it can't really depend on that. You may miss it if the changes are so subtle. Okay, that was later modified to give us the Akin criteria and the Digo criteria, which we'll actually be looking at next. So that's it for this rifle criteria for acute kidney injury.